Okay, so again, thank you all for being here to our Lunch and Learn series. My name is Sharice Iglesias. I'm the Training and Resource Director here at Community Campus Partnerships for Health. And today we will be focusing on managing project startup. But first, I'm going to pass it over to our Spanish language interpreters to give y'all some instructions. Alejandra, David, are you able to give people instructions? Oh, excuse me. I need to, some technical difficulties. Thank you for being patient, but I need to end interpretation.
Hello, everyone. Thank you and apologies for the technical difficulties. We will be the interpreters for today. Myself and Alejandra, and I'll be giving these instructions in English and then in Spanish. Hola, muy buenas tardes. Me llamo David Cruz y aquí con mi colega Alejandra seremos sus intérpretes por el día de hoy. Daremos estas instrucciones en inglés y luego en español. If you're accessing this call through a computer, once the interpretation feature is turned on, you will see a globe on your bottom right-hand corner of your screen where you will click it that says interpretation and select the language that you prefer to hear this call in, that being English or Spanish. If you are a monolingual English speaker, we do recommend to please access the interpretation channel. That way you hear the interpretation from the individuals in the opposite language channel. If you're accessing this call through a cell phone, tablet, or iPad, you will lightly tap your screen to activate the menus at the bottom panel of your screen. You will scroll to the left until you see the 3 dots on the bottom right-hand corner of the screen or the globe that says interpretation, and consecutively select the language of your preference. Si usted está accesando esta llamada con una computadora laptop, una vez que se encienda la función de interpretación, usted verá el globo terráqueo en la parte inferior de la mano derecha de su pantalla. Usted seleccionará el lenguaje que usted necesite. Si usted está accesando esta llamada con un iPad, tableta o teléfono inteligente, usted tocará la pantalla levemente para activar los menús en la parte inferior de su pantalla, deslizará a la izquierda hasta que usted vea los 3 puntos en la parte inferior de la mano derecha o el globo terráqueo y seleccionará el lenguaje que usted prefiera. Se le alenta encarecidamente que por favor seleccione un canal de interpretación para poder escuchar las personas en el canal opuesto. Muchas gracias. Thank you very much.
Thank you, David. I'm going to turn it back on. Does that work? Okay, thank you. Okay, thanks everyone. I'm going to share my screen and we're going to get started. Okay, so I'm going to start with a poll just to get everyone's, just to get a sense of who's here. This project startup. So poll, how familiar are you with research project startups? So feel free to answer the poll next 30 seconds. Just want to get a feel. We have some amazing panelists who can clarify some, some questions you may have about research project startup. But yeah, I just want to get a sense. So very familiar, not so familiar, very unfamiliar. Gotcha. Awesome. I like this. I'm going to end the poll, share the results. Thank you all for participating in that. Like I said, we have a lot of cool panelists and speakers in this presentation who can help clarify some questions you may have. For those who are unfamiliar, Community Campus Partnerships for Health is a small nonprofit that promotes health equity and social justice through partnerships between communities and academic institutions. Our work is guided by these strategic pillars where we lead discussions, conversations on authentic and equitable community academic partnerships. We disseminate information and resources. We serve as like a liaison for communities and academic institutions. And we also provide technical training such as this. I just want to highlight real quick one of our long-standing partners, Clinical Scholars, funded by the Robert Wood Johnson Foundation, where they focus on equity-centered leadership. And for those who don't know, the Clinical Scholars are an amazing group of clinicians who work in their local communities to address health disparities. And from our 7-year partnership, we've been able to support their projects, sharing technical expertise just based on the 25 years of experience that we have gathered as an organization. So an icebreaker, again, I want to get to know a little bit more of who's here. If you could, in the chat for the next 30 seconds, include your name, your pronouns, as well as your organization or affiliation. I'd love to know who's here, who we're interacting with. So feel free in the chat to write your name, pronouns, and your organization or affiliation. Oh, nice. Karen, Ivy, UCLA. Oh, I'm in NorCal. Hello, Ivy. Heather, Kieran, Susan, Pilar, Ginny, Laurie. Nice. A lot of people. I'm so glad you're all here. Again, welcome to our Lunch and Learn series. I'm going to move on, but feel free to introduce yourself in the chat, say hello to people who are in your area. So the learning outcomes for today are to review the Community Campus Partnerships for Health Principles of Partnership, just to frame our conversation. We're going to list the components of partnership agreements, and we're going to describe strategies to facilitate, organize, and maintain healthy, authentic partnerships. Okay, so I'm going to pass it on to my colleague, Alan, who will lead us in our discussion today. Go ahead, Alan.
Alan, you're muted. Alan, you're muted.
I'm so sorry, everyone. My computer is having a little delay, and I thought I was unmuted. So let's go quickly through some baseline sort of principles and things to get our conversation started today. We'll be using the term authentic partnerships quite a bit. In simplest terms, if a partnership is authentic, it's true to its values and its spirit, regardless of the pressure that it's under to act otherwise. And this is, of course, talking about community members coming to an academic center or a medical center. In framing that, we're going to be talking about the principles of partnership. The principles of partnership have been widely used. They were developed by the CCPH Board of Directors. They're kind of part and parcel of other NIH-funded research as kind of a guiding mechanism. They are Donabedian. If you recognize the researcher, Avedis Donabedian, that means they are organized according to structure, process, and outcomes, which is the kind of the classic format that took medical work and research work and looked at it and its outcomes more fully, and was kind of revolutionary in its own time in the 60s, and now is widely used. We're going to be talking about research planning and design, in particular the research from the side of the community understanding it, the community being vested in it. And the idea of inclusive facilitation does just that. It takes research and research teams and includes community members and involves them by mentoring them, by including them in designing questions, etc. Next slide, please. Oh, Daniel has a question. Please put it in the... Okay, so the principles of partnership, as I mentioned, are organized along structure. We set up fair systems of representation. What does this mean? In the beginning, we talked about the sharing of resources. We talked about how decisions leadership. In process and action and research plans, we talked about a community-based participatory approach to research, wherein the process of designing the research questions not only meet the demands and the impetus of the funders, but it also includes the insight of the community members themselves. And meaningful outcomes and transformational impacts is, again, just what are your short-term impacts, like what are some immediate changes you might want to see, and what are some transformational impacts. For example, I know coming to the research world, I was worked in HIV activism in the late 90s, and now I can see how disease advocacy morphed to huge institutions of clinical research, to service support organizations, and mentoring of people from the community who became doctors, social workers. And so including the community in the system of research also has transformational impacts in infrastructure, systems of health, cultures of health, and even individual careers. Okay, so we have a question from Daniel. I will kind of send that to our training director, Charisse, to answer and kind of move on. Daniel, I don't really know the answer to that, but I think we will address it before the end of the session. Next slide, please. Okay, so relationship building as a part of the process we just discussed, and you're going to be hearing from distinguished panelists today from University of Alabama, Birmingham, which is a very big medical center that has a history with an health equity center. So this idea of building structure with a community group is, how do you build trust? How do you do exercises such as team building? How do you acknowledge assets, which is extremely important when you're working in a field of health disparities, which typically highlight just that. What are disparities and underrepresentation? How do you go into a community and look at its strengths and leverage those as well? And how do you create fair systems for resource sharing and open communication? And that's where we're going to go into a little bit more detail about partnership agreements and partnership processes and structure. Next slide, please. So beyond relationship building, we'll go to the next slide. And we're listening and planning. So how do you start a new project? Sometimes new partners will come to the university that don't have a long history of working with the university. So you have to generate ideas and hear people's voices. How do you generate something like a shared mission? How do you look at your shared values and goals? How do you create a research plan with agreement on outcomes and processes? There's an advocacy phrase that you see a lot with disease groups called "nothing about us without us." So for example, if you're studying, pardon me, take a sip of water here. If you're studying disability, are people with disabilities advising you on what kind of outcomes matter to them? What is therapeutic efficacy to the people that are your constituents? How do you plan a process, moreover, for closure and sustainability? Funding comes and goes, and partnerships have to be sustained beyond this. Sometimes a good community engaged researcher will just hold programs and lunches and check-ins that are not related to funding so that the partnership remains viable and alive. And we believe that this commitment to capacity is very important over time. Okay, next slide, please. And my computer's a little bit slow here. We're looking at community impact. So this will go along the lines of outcomes and transformational experiences. What are the short-term impacts that you want to measure that make you accountable with the community? Partnership agreements on measures of progress and evaluation. are extremely important. Have you talked about your evaluation plan with the community? Have you taken on partnership plans that include sustainability and a focus on community health? And for long term, in your partnerships that you're working with, do you improve the health and the lives of the community in ways that are measurable to them and to your scientific funders? And this kind of nuance is in communication. It is a structure that sets up and facilitates these kinds of processes with your community academic partnerships. Next slide, please. And we look at the partnership agreements as something that we land on quite a bit. It's good to write it down. It's good to document. And what do you have when you come together for a health study or a long-term project with the community? Do you have common goals and objectives? Does your audience, do your partnerships understand the difference between goals and objectives? Some mentoring might be involved here. Do you understand expectations? Yes, if you're in a study that is data collection, do you understand why the data matter? What are the anticipated benefits? How will they influence the outcomes that the community is looking for? Very importantly also is what are the roles and responsibilities of the partnership? Who is a leader? How do you reach that leader? How do you understand the organization and how it functions and makes decisions? And how is the sharing of resources and community payment handled? That's very important. In the history of community academic partnerships, sometimes it's very cumbersome for community members to be paid, and they don't have the luxury of indirect costs. They don't have the luxury of coming into an office where the lights are already turned on. They might be a grassroots organization, so you have to be mindful of that. Comes to mind, I used to work with many groups that would say you're requiring an audit, but the audit is not in the budget. If you don't pay for the audit, we can't do it. Simple things like that in the agreement written out can be very important. Copyright and ownership issues. Who owns the data? Who's going to be an author? Are you sharing authorship? Do your authors have to go through city training in a university? Are they aware of that? Similarly also is the basics of an evaluation plan and a dissemination plan from the very beginning. How are we going to evaluate our work? How are we going to disseminate it in a way that the community understands it? It's a series of meetings, is it press, is it public relations? That you need to think about these things a priori in the beginning can be very, very helpful. Next slide, please. So I think we are moving on to Emily.
Yeah, thank you, Alan.
Today. Thank you, Emily.
Yeah.
We'll sign off.
So thanks, Alan. I'm Emily Finley. I'm an engagement lead at CCPH. Thanks so much for being here today, everyone. Just a few more little points that we're going to get in before we introduce our panel very shortly here. Alan touched on this issue of funding for community partners a bit, and this is something that is really important when managing a project startup, is figuring out a way to make sure that the funding structure is equitable and fair for all partners. And we bring this up because, as Alan mentioned, we often see community partners kind of getting the short stick or whatever with funding because they often are smaller, don't have as much administrative or fiscal infrastructure as like a large academic institution, and this can lead to a lot of challenges early on if a payment plan isn't really thoughtfully built out. So this slide sort of speaks to some barriers and facilitators to fiscal equity between academic and community-based research partners. And some of the biggest barriers just come with communication gaps. So not understanding how fiscal processes work, not understanding maybe what's the protocol for submitting an invoice and getting paid. How long do I have to wait? You know, these types of things. Limited support to community partners, fiscal capacity, you know, and just overall lack of awareness of each partner's processes, procedures, and needs can all be barriers to fiscal equity in the beginning of a project. But some of the main facilitators are developing fair contracts and payments at the outset. So having that as part of that partnership agreement that Alan talked about. Having early and timely communication among all partners. So that includes even in the grant writing stage at the very beginning, sort of knowing what the expectations are going to be. And yeah, an engagement throughout pre and post award processes. So next slide, please. So just quickly, some action steps that can be taken to level the playing field and enable some power sharing, you know, in terms of the funding, is to, as I said, include community partners in all phases of, you know, the funding process. Be transparent about payment timelines, approval processes, all of the steps that it takes administratively. Outline clear procedures for tracking and managing payments is very important. Supporting partners in building fiscal and administrative knowledge, skills, and infrastructure. This is another thing that you know, partners can lean on each other for if an asset is identified, you know, to share those assets and those skills to help build up, especially on the community end, to help build up that infrastructure, and also just you know, developing a more flexible infrastructure to deliver timely payments. So next step, please. Next slide, please. Okay, so very quickly, we would love to hear from our audience members about a project startup that you have worked with. So get in the chat, tell us about where you're coming from. You know, if you have worked with a project startup, we would love to hear from you. And then we're going to transition to our panel. So I think we can pull up the next slide. And so I will introduce our speakers quickly here. So we're going to have a moderated discussion, but please feel free to place your questions and comments for our panelists in the chat. So starting from the left, we have Tiffany Osborne, who serves as Director of Community Engagement for the University of Alabama at Birmingham Minority Health and Health Equity Research Center. And Tiffany brings more than 25 years of experience building and maintaining strong academic community relationships. We also have Dr. Gabriella Oates, Associate Professor in University of Alabama at Birmingham Hearsing School of Medicine. She's a social epidemiologist focused on social determinants of health and health disparities research. And finally, we have Dr. Lori Brand Bateman, Assistant Professor in the Division of Preventive Medicine, also at the University of Alabama at Birmingham, who is a medical sociologist with training and experience in community-based participatory research, our favorite, health promotion, and bioethics. So thank you to all of our speakers. Welcome. So to get started, I would just love to hear from each of you about a project that you have helped start up and some of the, you know, challenges, but also high points, low points. And I know that you are colleagues on a project together. So tell us about your work and your projects.
Tiffany, do you want to get us started? Yes, I'm sorry. I was looking for takes a while to find the unmute button. Um, but yes, we're so excited to be with you this afternoon. Thank you so much for having us. Lori, I believe you have our slides available.
Sorry about that. I'm sorry, Tiffany. I thought you were going to be changing them. Let me get them real fast. So sorry about that. You can go ahead and get started if you want. And
Yes. So absolutely happy to. So I do serve as the Director of Community Engagement for the Minority Health and Health Equity Research Center. This is a university-wide interdisciplinary center that has been in existence for 20 years under the direction of Dr. Mona Fouad. Started with a very small pilot project of about $50,000. And over the years, we have become an NIH Center for Excellence. And we work in under-resourced communities, helping to address health equity, working with them to overcome barriers that are keeping them from living their best health. We have 3 pillars within the MHERC, as it is affectionately known: training, research, and community engagement. And all of those are working very closely either with historically Black colleges or universities and community-based organizations to help connect those communities to resources. One of the things that we do within our department, we have a small but mighty team. We sometimes are managing upwards of 13 grants projects at a time, working with researchers like Dr. Bateman and Dr. Oates to help connect them to community partners, identifying those partners, and continuing to serve as the link between those between the researchers and the partners. One of the unique things about my team is that we are not merely there to serve as a connector, as a facilitator, but we are a part of the research team. We work hard to make sure that we understand the vision as well as the aims and deliverables of each of these projects, so that we can be the voice that is able to resonate with the communities that we serve in a language that they can understand. But now that we do have our slides, just gives you a quick overview, and this is what I was sharing with you earlier about our mission and the different pillars within. But the strength of our department is the diverse network of community and academic partnerships that we have been able to establish over the years. You can see to the far right of your screen, the green state is Alabama. And you can see we have partners all over the state, from most of them you can see in the central portion of the state, but we also have diverse partners in Mississippi and Louisiana. This has been a part of our academic and community partnerships and working with universities like LSU and universities in Mississippi to help us connect with those partners there. But one of the interesting projects that we worked on started about 6 years ago that really built off of the foundation of the MHERC, and that is called our Building Healthy Communities Coalitions. We have had BHCs, as they are affectionately known, since about 2006, and what we did was we went into communities, much like was as explained at the beginning of this presentation, did a needs assessment, identified key stakeholders, and asked them who's missing from this table, who's missing from the conversation, and then talked with them about issues and concerns, mostly surrounding chronic diseases. What we found over the years was that we really needed to take a deeper dive and address the social determinants of health that these communities were facing before we could really get them to hear us talk about preventive measures as it pertained to chronic diseases. So as we did that and really started focusing on social determinants of health, that really gave us a broader focus within to help these communities. And we started hearing about just basic needs that the community needed so that they would be able to overcome some of those barriers. Our Building Healthy Community Coalitions, as I mentioned, are built of diverse networks. We started with 5 in about 2019, I believe. And you can see in the central part of the state where the big star is, that's where Jefferson County is, where the University of Alabama at Birmingham is. We had 3 community coalitions there. Our first rural coalition, as the star where Orville is, which is a rural community just about 20 minutes outside of historic Selma, Alabama. And then Pritchard was the farthest from us, which is in Mobile, which is along the Gulf Coast. And these coalitions, the interesting thing about it was that in the beginning, when we would get started with these coalitions, they were designed to be able to get them going, provide them with the tools so that community members would feel empowered to be able to take ownership of these coalitions and come up with ideas and be able to identify resources with technical support from us. But what we found was that once we took our hand off of it, they really didn't maintain their structure like we had hoped. So the beauty of these 5 coalitions that were started 6 years ago was that we met with them monthly. We were in their communities, we were listening to their needs, we were supporting them as they brought up concerns about things that they needed so that they could live their best health. We worked quickly to be able to identify some of those. And so these coalitions are still intact. And they allow us very easily to go into a coalition and leverage additional funding opportunities. They kind of serve like our think tank and our connector to individuals. Always, as with any other group or coalition, they ebb and flow as their interests and concerns come about. But you can see the makeup of many of these BHC coalitions. They have a large African-American population of roughly about 75% or greater, high concentrations of poverty and low levels of education, 20% or greater without a high school diploma. Many of them suffer from food insecurity, access to transportation, medical services, and things of that nature are huge barriers for individuals that live in these communities. But this is the foundation of the MHERC that allows us to make the lift so much easier because we've been there month after month for year after year. They trust us. When we show up, when we ask for support, they're eager to help us, and they know that we're going to be there not only to just get them to help us with our research needs, but to hear what their basic needs are, and we work quickly to try and identify what those are. Next slide, please. And at this point, we want to talk about, because I'm sure you want to hear about some of the projects that we worked on. I'll turn that over to Dr. Lori Bateman to share our experiences here.
Okay, thanks so much, Tiffany. And I'm really glad to be here. It was a really great introduction by Alan and Emily. I kind of wish I had that before so I could use the same terminology in our presentation, but so much of it overlaps, I think, with what you talked about. So it's really helpful. So I'm just going to quickly introduce a couple of projects, one that started really quickly and then one that took a lot more time, but the basis is really the model of the BHCs, the Building Healthy Communities that Tiffany just talked about. So if you could go to the next slide, please. So this actually, I wanted to talk a little bit about our COVID research, and I know probably many of you have examples of this too, but I just wanted to show that, our BHCs really served as the foundation to get our COVID research off the ground. you know, because we had partnerships, well, of course, in, let's say 2020, in March of 2020, all of our community engaged research basically had to shut down, right? And because we had these strong partnerships, we were able to think about, okay, you know, how can we get some research quickly off the ground so we can understand what's happening in these communities? We know you know, we're all scared. What are the unique needs in our these 5 communities? How can we learn about them quickly? And so in conjunction with our CE team, myself and some other research decided to put together a study utilizing focus groups that we conducted through those BHCs. Members of those groups helped us form the study. We sent the study through the IRB, and we were able to recruit using individuals that were part of those BHCs quickly, and we had the whole thing completed by May of 2020, which is really pretty quick for a research study. And it really kind of showed the community that we as an academic institution cared about hearing from them. So we were able to really learn kind of what their struggles were, what their fears were, what they needed. And we were able to respond to that really quickly. And so I think there's a few things to remember as you're starting a project up. Number one, and these were all mentioned before, but just establishing these clear lines of communication, consistent messaging, transparency, and accountability. And I think one of the most important things we were able to do with this study is to be accountable to the community. We listened to what they said, and then we were able to go back and actually meet a lot of their needs. And through that initial study, we were able to fund, apply for a SEAL, you know, a grant from SEAL, which is continuing. And then actually, this isn't even all the grants through RedX Up. I think we had 2 projects with RedX Up. Yes. And so anyway, that just wanted to kind of mention that study to start with. And then if you could go ahead and advance the slide. The second one I wanted to talk about is one where we really took a while to actually start the research. This is a grant. It's a DOJ funded grant. And it was awarded to the National Organization of Black Law Enforcement Executives, who came to us, UAB, as their primary partner. And we wrote the grant together along with our Bessemer Building Healthy Communities Coalition. And so that coalition was foundational. We had a very short time to write the grant, as does happen many times, as you all know probably. But since we already had the partnerships there, we were able to put together the grant fairly quickly, include the community, and get funded. So just want to reiterate the importance of including the community in that grant writing phase, because then once the grant is awarded, they already are aware, many of them are aware of that you have partners who are already sold on the grant and ready to work with or work together. So one thing that's really important is establishing lines of communication. And so once this grant was funded, can you go to the next slide, please? One issue we had, okay, maybe I should just quickly go through what this grant was. It was, number one, to establish and strengthen partnerships to build capacity and promote sustainable collaboration by leveraging community stakeholders and partners. And then so we used a CVPR approach to design an action plan that integrates crime control and revitalization strategies. It's a community engaged crime reduction grant, which I should have said at the beginning, but I'm in a hurry, sorry about that. And then, so we took a year basically working with the community to design an intervention, and the intervention is what we studied. And so we spent a long time working with the community to start that grant up and that project up. But once we designed an action plan, then we implemented it along with community partners. In fact, the entire grant was implemented through community partners in Bessemer. So if you can advance the slide now, thank you. And so this really explains our process. And like I said, keeping lines of communication open is really important in establishing those lines. and having clear and consistent messaging. And I think one issue that we encountered is that because we were a subcontract to a kind of this national partner, we didn't, and this is the first time we'd really done this, we didn't really have established lines of or clear lines of communication established, I should say. And so we started meeting with the partners along with the main partner, or I'm sorry, our funder, I should call them, Noble. And the partners were confused. You know, who do we report to? Who do we call to if we have questions? And I think we had to quickly talk with our funder, and it was decided that our community engagement specialists would continue to meet with them because they were the ones who had established the relationships, if that makes sense. And so I think just establishing those clear lines is so important from the beginning. The other thing that's really important that Emily mentioned is this issue of funding. Community partners often do not understand how long our processes take. And honestly, they take obscenely long sometimes. And so one thing we have done in many of our grants is establish a fiscal agent, which really does simplify the process for community partners. This fiscal agent then is able to pay the partners. And we did this for this grant. We can pay them much more quickly and simply than going through all the university processes. Basically with this grant, what we did, again, to include partners, this is an intervention mapping approach. Quickly, I'll just say, you know, what we did is we established a partnership advisory board that we started with our Bessemer Coalition. They recommended partners. We established sort of a partnership advisory board and we went to them with all of our questions and concerns and updates about the grant. We included community members and stakeholders in key informant interviews to build this intervention. We designed an intervention plan and then took it to focus groups, town halls. We conducted surveys and then actually presented it to the mayor's office. And at each stage, we refined the process until we got to our action plan. And so we really felt like the community owned the intervention. And the other thing that's important is accountability. And we did that through the advisory board. We also, and most of our projects, of course, have community advisory boards. But then we also take the results back to the community, right? The findings back to the community, which we did in town halls, and we do in town halls. We have town halls every other month now, and we're going to present the final findings in November. And back to funding, I think that it's important for community partners also to realize that, you know, that researchers in general really do want to meet all their needs. And it's really important for community partners to be transparent about what their needs are and really try to think through those. And I think as academic institutions, we need to help them do that. We did have one issue in this grant where at the end of the grant, the partner really wasn't happy because the partner felt like they didn't get funded enough, but we did meet the need that they asked us for. And so that may have been our fault for not pressing further. But I would just encourage partners to sort of really try to estimate their needs so they can get what they do need to carry out the work. So I'm going to stop there. And I think Tiffany has a few more things. We could answer questions, but I think she was going to, so either way.
Absolutely. So, yeah, if we can go back to the other slide, want to just talk a little bit about, you know, some of the ways that we've been able to work with our community academic partners. We have a small but mighty team within community engagement, and I'm sure like every other organization that works with grants, there's always a lot of effort, but never enough staff to be able to get the work done. And so we truly rely on our community partners to help us get the work done. But what we found was that while they may be passionate about assisting their communities, they need a little bit help with infrastructure, leadership, advocacy, and things of that nature. And so what we were able to pull together with one of our projects was a community leadership academy. And our inaugural class just started about a month ago. And we were able to pull individuals from the communities that we work in, and they are now going through, I believe it's a 26-week program that's free, that will provide them with a number of tools and resources so that they can, in effect, be impactful leaders in their communities. Not only that, it's so important for our communities to understand the importance of research. As Dr. Bateman mentioned, communities would oftentimes hear that universities or us received millions of dollars to do work in their community. And what doesn't resonate is, okay, I heard that you got $1 million to do work in my community, but I don't see the impact of those funds in my community. And so the Community Research Institute, which again just started this year, it allows them to understand that we are doing research. And so a number of those funds are for research. And hopefully, once we finish this and we get that data, we'll be able to make a case to be able to speak to the specific needs and concerns that you have in your community. Another way that we've been able to establish ways to include the community was something that started about 3 years ago, community engagement coordinators. When COVID hit, we had a challenge, because of COVID, it was polarizing politically. We needed trusted voices, boots on the ground, to assist us with getting the message out, assisting us with surveys and addressing the immediate needs. And so we were able to train lay community individuals, kind of like community health workers, but we took it a step further. They were trained to assist with the research team. They received IRB training, survey administrative training, and we were also able to provide them with a stipend to be able to supplement the workforce, because many of these individuals were also out of work. And so they started on one project, but because they have all of these skills that we have trained them with, we can leverage them on many projects as we get new grants that come in. And so we're just so excited to be able to have this additional arm. We do also have community health workers who assist us. There's a coach corps of which Dr. Lori Bateman is on. And then as Dr. Bateman mentioned, they helped us, the community helped us with qualitative community engaged research. And this was so pivotal during the start of the COVID pandemic. We had to teach them how to use Zoom. But once we did that, they just wanted to be heard. They wanted their basic needs met. We need fact-based information. So we worked with our communications team to do yard signs. We did pop-up clinics in their communities because that's what they told us they wanted. Next slide, please. And then just to kind of reiterate what Emily said earlier, but partnerships are developed and nurtured over time. We've been doing this for 20 years, and we have had some of the same partners who believe in what we do. We support them and they support us. And this is what really allows us to make the lift so easy when we go into communities. Oftentimes researchers will look at my department and say, gosh, you guys are working magic over there. And really it's not. We do a lot of early on work of networking, keeping our ear to the ground to hear what organizations are out there doing amazing work, and really just building those relationships, oftentimes long before we need them. And so when we do actually need those partners, it doesn't look like we're just coming to talk with them because we have this project. We've been working on that for some time. But it's also very important for us to make sure that we're finding ways to continue to work with the partners over time in ways that are mutually beneficial. And again, as can't say it enough, always include these community partners at the very beginning of grant planning and throughout the process. They want to be involved. but we have to sometimes help them to understand the correct questions that need to be asked. And so with that, I want to pause because I do know that there have been some questions in the chat box and want to be able to allow plenty of time for that as well. But thank you for
Yeah.
your time and attention.
Thank you so much. That was really amazing. So much information there, and it really demonstrates how establishing those long-term relationships can allow you to, mobilize quickly for a crisis like COVID when it happens. So there are a couple questions in the chat. Can you talk more about how you selected and set up the fiscal agent that you mentioned, Dr. Bateman?
Actually, I'm happy to speak.
Yeah, sure.
That that is a component of the community engagement team. So what we do, UAB, you have to become a vendor. And so there is that process. And then you have to complete what we call a fee for service agreement or contract with UAB. That is another process, and that can take plenty of time. And you do have to have a certain infrastructure in place in order for those documents to be approved by our finance department. And so what we found is we identify a stable community-based organization that has the infrastructure, the team to be able to assist us. We provide a fiscal agent fee for assisting us with the work. We'll put together a scope of work that is about more than just paying partners. It's about helping to connect us with partners, meeting with us to talk about program aims and deliverables. But they have their system in place. And so what we can do is we can get that CBO approved through UAB's process. And then the smaller partners, individuals who don't necessarily have the infrastructure to follow that process, they don't have so many hurdles to jump through. They can just very easily work with that CBO. And so we will establish a contract, we'll submit invoices for that one, and then we'll continue to work with the smaller individuals or nonprofits with the CBO that we identified to serve as the fiscal agent to then disperse those payments to our smaller entities. And we have found that to be such an easier way for us to continue to maintain those relationships and trust, because as you can imagine, partners get pretty frustrated because many of them don't have the upfront capital to be able to wait 2 to 3 months for, as what Dr. Bateman said, our obscene long processes.
Yes.
To get something approved. So yes, that's how we manage those, and we'll have them depending. They may work with us across several projects, several grants, and they just keep accurate accounting of, this is grant A, this is grant B, and we have a series of checks and balances. They'll check in with us periodically, but we know how much funds are there. And again, we'll compensate because we know we're asking the staff at the CBO to do extra, go above and beyond. So we do compensate them for assisting us with that project.
Thank you. So unfortunately, we do have to move on to close. It is 1 o'clock here on the East Coast. But that was a really, really wonderful presentation. And there were a couple questions that we didn't get to. So maybe if our presenters don't mind putting your email in the chat, and maybe people can connect via email. There were also a couple requests from people who were interested in seeing some of the training materials that you've developed, the Community Leadership Academy materials. So for now, I'm going to hand it back over to my colleague Charisse for our closing. But thank you very much to our amazing panelists.
Yeah, thank you to our amazing panelists. That was amazing. Yeah, I put a link in the chat to continue shaping our learning, our shared learning spaces, our experiences. I invite you to take this very short evaluation. And then just to wrap up, again, thank you for your time. Please visit our website, ccphealth.org, and you can also catch us on social media. And the last thing I want to share is we have 3 more Lunch and Learn workshops, one in November, December, and one in early January. The one in November is Managing Project Wrap-Up. So that's like part 2 of this workshop, like how to close it, making sure all your community and academic partners are receiving the things that they need, right, to exist outside of the project. So feel free to share that with your networks, with your colleagues, people who would benefit from this kinds of conversation. And yeah, thank you again for coming, and we hope you have a wonderful day.